If you're having a hard time getting hard, you're not alone. I'm Dr. Adam Goodcoff, and in today's video, we'll explain where erections go wrong. Erectile dysfunction affects nearly 300 million men worldwide. Yes, you heard that right. Almost 8% of the male population on the planet has a hard time getting hard. As you know, men have erections. While an erection does make the penis longer, the process in which this happens is actually fascinating. You see, not only does the penis lengthen, but you may have also noticed that it gets more wide and full. Think of a balloon with me. When you inflate a balloon in the air, you notice that it begins to round out and expand as it desires. There is no limit on its shape. Now imagine if you put that balloon in a small metal box with no lid on top. As you begin to inflate the balloon, you can imagine that the balloon begins to expand upward, restricted by the sides of the box. The same goes for the corpus cavernosum and the tunica albuginea. As blood flows into the cavernosum and begins to fill, the cavernosum begins to swell, increasing the length and width of the penis. Once full, the penis is firm and hard to the touch. The pressure inside the penis is no joke and can reach up to 100 millimeters of mercury. So what goes wrong in those who can't achieve an erection on their own? First up, it's no surprise that many Americans struggle with erectile dysfunction, since a large number also struggle with hypertension, hyperlipidemia, and heart disease. These three conditions all affect the blood vessels and their flow. One of the most frustrating causes is the use of antidepressant medications. Up to 50 to 70% of patients taking these medications may experience decreased sex drive, known as libido, or even experience erectile dysfunction itself. These medications can improve your mood through neuromodulation, but they can also cause weight gain, an independent risk factor for erectile dysfunction, and erectile dysfunction itself. Now that we know some of the causes, what can be done? The mainstay of treatment is a class of medications known as PDE5 inhibitors. These are prostaglandin-inhibiting medications that exert their effects on smooth muscle, allowing relaxation around the arteries and increased blood flow. The more blood flow, the more likely you will successfully have an erection. There are two main problems with the medications that promote erections. You might be thinking the first risk is a heart attack. Many doctors also thought this for years, but a few studies have been done and have shown that the risk is minimal, if any, on having an actual heart attack. Honestly, the act of having intercourse probably increases your chance more of having a heart attack. What the medication can cause are low blood pressures, and that comes from the relaxation of the arteries. When the blood pressure is low, we have an increased risk of low flow to the brain temporarily, which causes us to pass out. The next risk is much more concerning. That is the risk of a priapism. You've likely heard commercials saying,
"To avoid long-term injury, get medical help right away for an erection lasting more than 4 hours."
While this is a rare side effect of the medication, it is not unheard of. Priapisms are actually quite complicated. Just know that these are medical emergencies and can cause damage to the penis itself. These patients often have to undergo what is known as corporeal aspiration. In this procedure, the penis is numbed with lidocaine and a large needle is inserted into the cavernosum to drain the blood stuck inside out. Once enough has come out, the patient can often get rid of the erection and go about their day. Now, just like the increased flow in the cavernosum, let's create a large influx of likes on this video by clicking the like button now, and don't forget to comment and let me know what you want to see next. As always, click on that subscribe button to have your health explained.